A new day, a new hour, a new guest. Kisha Bird.
Hey.
From the US of A. Coming to join us today at Marsaw Media. Thank you for joining us.
Thank you for having me.
For those of you that don't know, I'm Troy Marsaw, aka Cowboy Troy. And I have in the studio here, our first time interviewing in this studio.
Okay.
So you're the first guest that we've had in the studio. So thank you for joining us.
Thank you for having me.
So tell us a little bit about yourself.
Okay, so I'm Kisha Bird, born and raised in Philly, so I always have to get that out there, rep Philly. And I've been in Ghana about 3.5 years. I came to Ghana for a new opportunity and I found love before I moved. And I have a company, Travel Deeper Inc., and we specialize in bringing our folks back to Africa and connecting to their roots, supporting artisans, and then connecting our issues across the diaspora. One of the main things we're connecting is around black women's health and shining a light on uterine fibroids and the things that impact us as women.
And so you're an advocate.
I'm an advocate through and through. My first protest was in Philly in the 80s against apartheid in front of the IBM building.
And so this issue of fibroids is an issue, a major issue for you.
Yes.
And why is that? Do you have an experience or?
Yep. So one is a major issue because it impacts about 80% of black women worldwide. In Ghana, it's 9 in 10 black women. So it's a major issue because it impacts us as black women. But it's something I went through personally. Had severe health issues when I was in the States, but didn't know I had fibroids. And when I came to Ghana, immediately the doctor, I had very low blood, I was anemic, and the doctor immediately said, let me give you an ultrasound. And I said, what? Why? And then he's like, oh, you have fibroids. You have many, and they're big. You didn't know that? I felt stupid because I'm educated and, go to the doctors. I felt stupid, and I had been having these health issues for about 12 years. Severe anemia, fatigue, heavy bleeding, and I just never even thought, Google WebMD, tell my doctor this is happening. I did, and they just said, change your diet, And so the uterine fibroid issue is something that we don't talk about enough as black women, and it's impacting us in our reproductive ages, starting in our 20s all the way, up. And it's something that is not just about, having birth, giving babies and having birth, but it's about our quality of life. One of the things I always say is, we go to the eye doctor and get our eyes checked. We go to the dentist and get our teeth checked, but we don't talk about our wombs unless it's something wrong. We don't talk about our wombs and being healthy unless, it's about us, having babies. And so for me, this work that we're doing, A Journey to Womb Wealth and Wellness, is about shining light on uterine fibroids, but it's about having healthy and whole wombs as black women.
But you said you had fibroids for 12 years?
Well, I'm estimating myself because I didn't get my diagnosis until much later. When I started having these issues, I looked in my chart, when did I first have my, the anemia show up, and they gave me iron, I never got infusions, sent me to a dietitian, all these kinds of things, change your diet. I start tracking back, when was I having the discomfort, like in my hips, in my back? When did I start having the really heavy bleeding and the heavy cycles? When did I feel debilitated that I had to take off of work? So when I tracked that, it was about 12 years.
But are you a person that go to the doctor regularly?
Yes, I go to the doctor, go to the GYN twice a year. I have primary care. My doctors were African American in the States. And like I said, all of these, that's why I went back to my chart and could track everything. And then when this was happening, they would, like I said, recommend me to a nutritionist and so forth. But what we know is to really understand what fibroids and where they are, unless they're really large, like by the time I got the ultrasound, they just do a touch test. You do a simple touch test, and the touch test will not show where your fibroids are, how they're growing. And so one of the things we're advocating for is for women to have early detection, to get screened, and to ask the questions that I didn't ask, which I know a lot of women also feel nervous about, because we trust your doctor, you're the expert. No, but we're the experts of our own bodies. And so that's what this is all about.
Well, your OBGYN, was she African American?
Yes.
So then you would think that with her being African American and OBGYN, she would be looking out for that more than someone that was non-African American.
Exactly. And so I had a long talk with her because I subsequently did get a myomectomy, and she was my surgeon. I did elect to stay with her. And what it boils down to me is that in the US, or maybe if people are in Europe or other places where there's not primarily people of African descent, there's just medical discrimination. Like, you can't just order an ultrasound because you think something is there. Because we're disproportionately impacted by this, it should be on an automatic test, because this is impacting us. And here, if you're in Ghana or in many other places, African countries, the whole population is of African descent. The whole population is African. So he immediately, when he saw the anemia, gave me an ultrasound. Didn't think lifestyle, didn't think, oh, you're overweight, this is why this is happening to you, you know?
So are you saying that you were diagnosed in Africa?
Yes.
So you were living with fibroids for maybe 12 years, but you only found out when you came to Africa.
Exactly.
And so you go to the doctor for what reason?
Yeah, so I was going to the doctor, one, because I was not feeling very well, and also I was continuing to check out my fertility issues and everything. And so immediately, they took my blood, and the doctor said, oh, you're anemic. I said, yeah, I've been anemic for years. Like, it's nothing. And he's like, no, this is serious. Your blood count is way too low. It should not be this low. I'm like, oh, no, but they told me, don't worry about it. And he's like, no, there's a problem. He gave me an ultrasound. I was like, do you know you have fibroids? And I said, no. And he said, you've never had an ultrasound? Like, looked at me, and I said, was I supposed to have had one? And then from there, I got, iron infusions to bring my, my hemoglobin up. I went 3 times a week. None of that was ever suggested when I was in the States.
You know what? With me being in healthcare, I have heard stories of women saying that their physician told them that they could live with fibroids, and that, unless they just wanted to undergo surgery, they didn't really have to. So is it something that you can live with?
So it depends on who you are. So sometimes women get diagnosed and they're very, very small, and the doctors say that you can manage them and so forth. I'm taking the approach, and what I've been talking to lots of different people, I think we need a and/or approach, all of the above approach. So yes, we need our medical doctors and we need their knowledge and all of that, but we also need to understand, how do you manage fibroids? These are mass that they're non-cancerous, but mass that are living inside your body. They should not be there. Why are they there? Hormonal reasons, some folks say. Some researchers say it's from trauma and mental health, not just what you eat. And so if that's the case, if we're managing, then that means we need to get our hormones back in balance. We need to think about what we think, how we eat, how we move. And so I don't think there's just an easy way to answer that. And I also think for Black women, whether you're in the US and Ghana, Jamaica, UK, we can't just trust the doctor just say, okay, you're fine, we can live with that. I think we have to take matters into our own hands.
Yeah, but you can't self-diagnose.
No, you can't self-diagnose.
So then how would you know it's a fibroid?
You need the doctor. That's what I said. You absolutely need a doctor. And what we've been doing, and we did this last July for Fibroid Awareness Month, we partnered with 2 hospitals to do screenings, to do early detection and screenings. And we had women as early in their early 20s women who were in their 50s, first time getting an ultrasound. Many were nervous, like, oh my gosh, I've never done this, but I'm having these issues. Could it be a fibroid? Could it be something else? And so there are other wound-related issues as well, but the first thing you have to do is to know if it's there. And so that's why we have to be able to have our medical professionals being a part of our healthcare too.
Well, let me ask you this question. So if you know this and you're a non-physician, then my question to you is, let's put you in the role of the physician. What would you do differently if you were an OBGYN?
Yes, oh, that's a great question. Well, what I think really needs to happen, because we know this is disproportionate to Black women, so if we're talking in the U.S., then screening needs to happen. It needs to happen early. It's starting in your 20s. We need to be able to advocate, whether it's paid through our insurance or whatever, that is a part of our woman's wellness care, that you automatically get screened. Like, it's not a question, so you have symptoms. If we're talking about prevention or we're talking about early detection, that has to be number one. So that's number one. Number two is that when your patients tell you something, you can't have a bias and think something else. And we know medical discrimination exists, especially with Black women, who present as either overweight or something like that, that diet, exercise. And we know diet, exercise is very important, but diet and exercise won't remove fibroids in of itself, And so if I was an OBGYN, I would definitely want to promote early detection, definitely listening to my patients and thinking about who they are as a woman of color, as a Black woman, and as something that disproportionately impacts them.
Okay, so here's your opportunity today. I want you to look into the camera there, and I want you to give women that are out there that don't know what, in your position, what you would say to help them as far as when they go to their doctor, what to say to their physician to assist them in this type of situation. So what would you tell them to do?
Yep. So the first thing you have to do is you have to request an ultrasound, an abdominal ultrasound, so that you can see what is going on in your body. Not just your normal touch test exam or your pap smear. You need an ultrasound. And they may tell you, well, there's no reason for it because your insurance may not, cover it. You have to request that. The second thing is we have to understand our bodies and what is going on in our bodies. We think our periods are supposed to be painful. We think it's this time of the month. Oh, I have cramps. Yes, but we're not supposed to have painful periods. So we need to be able to track what's going on in our bodies. Like I said, this was going on 12 years, at least when I went back. Track what is going on with your body and advocate for yourself. And then the third thing I would say is arm yourself with so much information. On this journey, especially being here in Ghana, I've met herbalists. I'm into teas. We know fresh fruits and all that is important, but it is critical to feed our body and to balance our hormones. So ask your GYN, demanded an early screening and ultrasound. 2, write down what is going on with your body and share it. Do not be timid. And 3, arm yourself with information about wellness, mind, body, and soul, so that we can be our whole healthy selves.
So, Kisha, one of the things that we didn't speak of in this whole entire conversation is how much does it cost and to have a procedure or for early detection? How much is it?
Great question. So on average, and this prices in Accra, it's about 250 cedis, Ghana cedis, which is equivalent to a little less than 20 USD for a doctor to do an ultrasound, an abdominal ultrasound. And so this past July, Travel Deeper, through a Journey to Wound Wealth, we partnered with Lister Hospital and Plus Med Center here in Ghana, and the United Way and others. And we were able to screen only 50 women. Our wait list was large. And that's all the money we were able to raise. So if we could implore you out there to do anything, is to help us support women here, help us save lives, help us to educate. With just $20, you can help save a woman's life here in Ghana. So you can visit our website at www.traveldeeperinc.com for more information, and we'd be happy to have you be a part of our journey.
So what you're saying, Kisha, is that $20 USD would get someone a ultrasound?
Yep, it will get someone a consultation with a doctor, and we know here in, like I said, here in Ghana, it's 9 out of 10 women starting in their reproductive years who will experience fibroids. Some even die from fibroids because some of the conditions are blood clots and so forth. And so you let something fester and you could actually die from it. So we're talking about saving lives, and we're also talking about just healing, healing, like you mentioned, the whole family. And so we found that this July, so many women that we saw were afraid. So many women that we saw were grateful. They had never seen a GYN, women in their 20s, 30s, 40s, and 50s. And so this is also an opportunity for them to establish relationships with a specialist too.
So, as the saying goes, I am my brother's keeper. And so what I'm going to ask is that each one of you that's watched this video or that are watching this video, I'm asking that you guys take the information that Kisha's given, I'm asking her to give it again, and I'm pleading with you to give at least 20, if not more dollars, so that you can help someone with early detection. And so, Kisha, I'm asking you one more time to give that once again.
Yes, so our website is traveldeeperinc.com, so www.traveldeeperinc.com, and you can also follow us on Facebook and Instagram at Travel Deeper Inc.
And y'all know y'all blow $20 on nonsense. So please, think about mankind, your brother, your sister, and give them a helping hand. For some of you, $20 is nothing. And so if you can help someone with $20, do the right thing. You were put in for a reason. Do the right thing. From a business perspective, when we talk about healthcare and medicine, and this is first to the physicians out there, a lot of times what happens is that physicians, they know their craft as far as medicine, but they don't understand how to work within the system to get patients cared for in a way that they wouldn't have to go outside and look for other monies or other types of insurance. Learn how to play the game of medicine. If you have a patient and you know that an ultrasound is not included in their insurance plan, find something that would lead you, that would justify you giving them an ultrasound. And so there's nothing illegal or unethical about that. It's just that the majority of the African American physicians I've dealt with in the States, they're not really good at playing the game of medicine. They're very good, the majority of them, at what they do, but not knowing the game of medicine. And so I've heard physicians say to me, well, I didn't go to school, I'm not a business person. That's not an excuse any longer. I used to hear that all the time. I don't agree with that anymore. As time grows on you, as you're in the business, you learn bits and pieces, and if you don't, you should be learning. No one growth should just stop at this certain point and say, okay, well, I'm only a doctor and I don't want to know anything about the business side. You should want to know about the business side. Now, as far as the other side, when you're talking about the patients, right? I think that what happens with a lot of black people in general, we have so much going on in our lives. We're trying to make money from Peter to pay Paul and Paul to pay Peter. And so a lot of times we think that things that are really bad, it's normal because we can get through it. We can pray through it. We can ask for prayer. It can't be that bad. And so because of that, we allow these things to continue to get worse and worse and worse because we think it's going to just automatically go away. But that's not the way it works.
Yeah, and I will say that Black women and African women, we normalize pain. We normalize like, oh, this is supposed to be, and that's not the case. And so I really like that you said that. One more thing I was thinking when you were talking to the physicians, there's another group that we advocating, and that is the government and the health insurance companies themselves. And how do we advocate that they understand that something like this needs to be included in any woman wellness package or anything like that. And in Ghana here, the National Health Insurance Scheme, we're advocating that they fully cover not just the screening, but any treatment that Ghanaian women will need.
Well, let me say this to you. The business of healthcare is exactly what that is, business. And so it's to be profitable, right? And so I know you say as a patient or as a person that needs healthcare benefits, the system is not really set up that way. It's a smoke screen, okay? And you know, the whole thing is how profitable can I be? And you have to understand that the problems that we have as African Americans are sometimes not addressed because they don't feel the need to address them because that's money they have to spend that they would rather profit from.
Exactly, and so you're talking about the business of medicine. I'm talking about the business of people. This is womb work, right? And something we say, and I got from a sister friend of mine, you know, you heal the womb, you heal the world, right? So we don't know to have our voice in that way, and it doesn't matter from all walks of life. This happens to us, and so what we've been doing is talking to women, virtual spaces, women here in Ghana, to have that voice, to be empowered, to walk in and say, hey, this is happening to me. No, you're fine, Miss Bird, you're fine. No, actually, according to this study, it might be this issue, you know, and I need you to check me for this. This tracks with this, you know, pelvic pain and, heavy menses and anemia and all these different things that come with fibroids. And it can be really painful and debilitating. This is not normal, and I need you to do this. And we don't have that sense of agency and that sense of voice. So we have to be the patient advocates for ourselves.
Well, I can tell you this, and I don't know how the people out here are going to take this, but I believe that it's best if you can deal with a person of your color. And why I say that is this. I know there's a lower number of black physicians in the US of A than there are white physicians. And then it's even lower for women. So here's what happens. When you deal with someone that understands you, understands your lifestyle, how you live, they've grown up the way you've grown up, it's easier for those individuals to look out for certain things. I don't believe that white physicians, and don't take this the wrong way, I don't believe that white physicians sometimes mean any harm, but they're not accustomed to the way black people live and the things that they should look for all the times, and sometimes they don't even care to look, right? And so you have to find someone that's caring, that's nurturing, and that's going to take the time out to investigate you and your healthcare needs.
And I'll go two things further. I absolutely agree. In my case, I had African American doctors, but the system isn't designed for us. And so when I immediately addressed it, oh my goodness, Miss Bird, how could we miss that? Because the system isn't designed with this black woman in mind. When I said my healing began in Ghana, because it's debatable here. I've heard whether, it's public hospital, not so good, private hospital and healthcare here, I think pretty good. But the system is designed for black women, for African women. So immediately they already knew what was going on with me. I didn't have to say anything. And so how do we, because we are African American and we are living in the States, or our family members are in the States, how do we take that part of what is happening here in Ghana, which is good, which can be about care, which can be about I see you because this is our population, and have that over there. So our system needs to change.
Now,
so
when you say our system, which system are you referring to?
Well, we were talking about the U.S. in
Okay,
that,
US
in,
system.
in that
Okay.
way, in that way. And so the same way that we did, we know October is Breast Cancer Awareness Month. We know by this age you got to get a mammogram. Everyone knows. That's not just about women. That's corporations. That's men. That's families. That's, everyone knows that. We want people to have that same urgency, even if it doesn't impact you, for July, right? July is Fibroid Awareness Month. We want people to have that same urgency. Hey, you know, if you have a daughter, if you have a granddaughter, if you have a partner, if you have a niece, hey, did you go get checked? Did you go get screened? Because we know it shows up earlier with us. We know it shows up more severe, and we know it has other issues that compound when you just let a fibroid be manageable.
So I would say to you, take out time to take care of yourself in a better way. And I know that a lot of times you have so much going on with the children, stress, strain, husband, you know, just the whole thing of just trying to get it done from day to day. But I saw something that brings me back to this. I saw a story where a white fireman said to a young black man in the restaurant, he was crying. He had started the conversation, the white man started crying. And he asked him, why are you crying? He said, I did some terrible things in my past. And he said, well, you know what? If you want to share it, share it. He said, there were houses that were burning down, and there were black kids in that house. And I knew there were kids in the house. But I wasn't going to risk my life to go into the house to save those black kids. Even though I knew I probably could have saved them, I didn't save them. So I say that to say this. We as black people, we got to start speaking out when we have issues, because the others may not care about our issues. And if you're a black physician, become more aware and go above and beyond to make sure that your black brother, your black sister is in good health.
Amen to that, amen to that.
Yes, ma'am. So in closing, I would like you to say whatever you want to say to the young women out there with fibroids, or the ones who may not have fibroids.
Yeah, exactly. One of the things I've learned in this journey, my own journey, is that healing is a process, right? You don't, and I got a myomectomy, so I got my fibroids removed. But that just, a surgery doesn't make you healed. And so if I can say anything, is that we need to focus on our own healing, our holistic healing. That comes with our own voice, being advocates for ourselves, but it also comes with being mindful of what we feed ourselves, and that's what we tell ourselves. So how we think, being aware of moving, and that's something, quite frankly, I am working on myself. And what we eat, right? And who we surround ourselves with. All of that is what we know can impact what is going on in our wombs, what can also help heal our wombs, and what can also help us just to be free. And when we are free and when we are healthy and whole, the world is healthy and whole.
Okay, and so in closing, I would like to thank you very much for coming out and sharing that information with us. And I would like to say that from me being in the business of healthcare, it's very important that male and female, both genders, it's very important that you take care of yourself, get regular checks up. I mean, men, I know that men, we as men, black men, we really, really don't do what we need to do as far as healthcare. And just like women, it's even more important if we're supposed to be the head of households to take care of ourselves, because if not, we perish, and then all we have left is women. And so I ask that the men take care of themselves, and at the same time, I ask that the women get themselves checked out, because it's just so important that we're around, to be around for our kids and teach them and educate them and what they need to know about life and health care and everything else that comes along with that. Thank you, Kisha.